President Trump has now arrived at the White House to give us an update from the coronavirus progress. Let's listen in.
He's done a fantastic job for the people of California, and also the people of California have done a fantastic job. When you look at the bump, you take a look at the bump and how they're doing out there. So I congratulate everybody out there. But I thought I'd have Kevin say a few words. So, Kevin, please.
Well, thank you, Mr. President. And I would like to thank you on behalf of California. Governor Newsom says the work that you're doing together has been working very closely. It's been effective in California as well, the Vice President and the President. You know, today, Mr. President, I want to thank you especially for the work that Secretary Mnuchin has done, especially for small businesses. Just today alone, I saw Bank of America had more than 10,000 loans in 2 hours. And for anybody who's in small business, I had first small business when I was 20 years old. You don't have income coming in right now. You get a loan, but for your rent, paying your employees, and paying your utilities is a grant. That's part of the CARES Act. And I think you're going to find that a lot of small businesses are going to hire people back, keep them afloat through the next 2 months, and get this economy moving again as we get through this virus. So I just want to thank you for all that work.
Thank you. Great job you're doing.
Thank you.
Thank you. You go ahead, Steve. I'll talk to you later.
All right.
Okay, thank you very much, everybody. And I want to start by saying that our hearts go out to the people of New York as they bear the brunt of the coronavirus pandemic in America. That seems to be the hot spot right now, but you have some others, as you know, that are very, very bad, very bad. Louisiana is getting hit very hard. Parts of Michigan are getting hit very, very hard. New Jersey is surprisingly, it's much greater than anybody would have thought. They're doing a really good job. Governor's doing a really good job out there. New York's first responders, EMTs, doctors, nurses are showing incredible courage under pressure. They're the best in the world. We will take every action and we'll spare no resource, financial, medical, scientific. We will not spare anything. We'll get it back into shape. The Empire State, the governor's doing an excellent job. They're all working very hard together. At the request of the governor, as you know, the Javits Center, we have 2,500 beds, and we're going to allow that to be a system where this horrible disease can be looked after, the patients can be looked after. That was going to be for regular medical problems such as accidents. And, you know, it's very interesting. The governors tell me we don't have too many accidents. There are very few people driving. So we're going to put that facility into play, which is a big facility. The ship will be staying the way it is, but we're putting that facility into play to help them. And today also the CDC is announcing additional steps Americans can take to defend against the transmission of the virus. From recent studies, we know that the transmission from individuals without symptoms is playing a more significant role in the spread of the virus than previously understood. So you don't seem to have symptoms and it still gets transferred. In light of these studies, the CDC is advising the use of non-medical cloth face covering as an additional voluntary public health measure. So it's voluntary. You don't have to do it. They suggest it for a period of time, but this is voluntary. I don't think I'm going to be doing it, but you have a lot of ways you can look at it as follows. The CDC is recommending that Americans wear a basic cloth or fabric mask. They can be either purchased online or simply made at home, probably material that you'd have at home. These face coverings can be easily washed or reused. I want to emphasize that the CDC is not recommending the use of medical grade or surgical grade masks, and we want that to be used for our great medical people that are working so hard and doing some job. Medical protective gear must be reserved for the frontline healthcare workers who are performing those vital services. The new mask guidelines also do not replace CDC's guidance on social distancing, including staying in your home when possible, standing at least 6 feet apart for a period of time. Again, we're going to all come back together here. We're going to all come back together and practicing hand hygiene, which we should do anyway. A lot of things I think are going to spill over. Shaking hands, maybe we'll stay with our country for a long time beyond this. One of our great doctors was telling me that, as you know, we have flus every year, and the number of people killed by the flu is very substantial. It said that if they didn't shake hands, that number would be substantially lower. So maybe it'll stay. Maybe some of these things long-term will be good. But those guidelines are still the best and the safest way to...
So President Donald Trump updating Americans right now on masks. That's something we have heard the president now talk about, saying the CDC is recommending cloth-based masks. The CDC saying a basic cloth or fabric mask. It's voluntary. So it's not mandatory. It's voluntary, according to the president. And the president made it clear that he wants those N95 masks. Those are the ones that the healthcare workers use. He wants those to be reserved for those heroes that are on the front line working with the people who are sick. And he also talked about social distancing being important, staying 6 feet apart. That's certainly important for all of us to remember. So if you'd like to continue watching the president's remarks at the White House, we can provide that for you. It's on all of our digital platforms.